Here we've got like a half of a nodule, it looks like, cut down the middle. This is the lowest power I can get. So what do you think from low power? Like what's going on here?
From low power, I can see that there are some hypercellular and some hypocellular areas.
Good, yes.
And it seems to be formed from spindle cells.
That's right. It is made of spindle cells. And there they are. But I like, in all of pathology, but I think especially in derm path but also in soft tissue, the low power, you can get some clues, right? Before we look at the cytology, we can look, is the whole thing homogeneous or is it heterogeneous? Like this is heterogeneous, right? We've got, like you said, cellular areas and then less cellular areas. Is it infiltrative or circumscribed? Well, this has got a nice circumscribed appearance. Here, it's a little hard to tell where exactly we are. Usually, like if this were taken off by a dermatologist or someone in the office, if we have a nodule with nothing around it, probably it's from the subcutis. But if it's taken out by a general surgeon, it could be from anywhere in the body where they've gone in and they've kind of peeled it off. Depends on, and I can't remember this one where this was from actually. But seeing, the size, the depth, how it interacts with the rest of the tissue, and then kind of how the cells are arranged in here, all can give us some clues about which way to go with it. So these are kind of all haphazard spindle cells, right, in this loose background. But then what about the more cellular area? What are the spindle cells arranged like here?
So the nuclei seems to be palisading, like parallel to each other.
Good. And in this area, that's pretty subtle, but you can still, with practice, pick up, look, draw a line here, and there's most of the spindle cells are kind of arranged along that line, like if they were like shish kebabs on a skewer, right? Like they're skewered all right here, and then there's a space of pink without as many cells. Then there's kind of another little zone or band of cells that are kind of parallel to each other. It's pretty subtle, right? A lot of times, junior residents, I'll tell them, and they're like, "What? Palisading?" They don't believe me. But you believe. You've drunk the Kool-Aid now. You believe. And look, oh, there's more. See? That's palisading. But if you don't like that, then let's find the really good palisading. The stuff that the books have. That's what people want to see. That's a little bit more convincing, huh?
Mm-hmm.
Like that's a line right there. That's a palisade. So, okay, so what do we call these structures?
We call these Verroque bodies.
Yeah. It's nice parallel palisaded nuclei. And of course, the diagnosis is?
A schwannoma.
Yeah, schwannoma, or old school name neurilemoma, if you like. I just call them schwannomas. But that is one of the most classic features, right? Is hypercellular Antony A, hypocellular Antony B, and then nuclei arranged in palisades with those nice Verroque bodies. But the thing is that in real life, sometimes the palisading is not really obvious. And so recognizing the other features of schwannoma is really important because it can get you out of trouble, especially if you get like a core needle. So that's sometimes happens because the retroperitoneum is a pretty good site for schwannomas to grow, and they can become quite big there. I've seen them like 10 centimeters or larger, and they can grow for a long time. And as they grow and kind of get older, this is the theory at least, they can get some weird changes, what we call ancient change. And some of those are cystic blood-filled spaces, sclerotic hyalinized collagen, and big scattered degenerative nuclear atypia, ugly pleomorphism scattered about. Oh, look. So this one doesn't have the sclerosis and blood-filled spaces so much, but it does have the scattered, what we term degenerative atypia or ancient kind of atypia. Whether it's really time that causes this or not, I don't know. It's a nice story, though. That's what we all say. But I have no idea if it really is what happens. I do think those retroperitoneal ones probably tend to be there longer because they grow bigger before they cause symptoms. And then they have been sitting around and bleeding into themselves. So it does make sense they get some change. But you can see scattered pleomorphism, this degenerative, hyperchromatic, smudgy pleomorphism in any schwannoma. And in fact, you can see it in other nerve sheath tumors too. Neurofibromas tend to have this sometimes, especially in patients with neurofibromatosis 1. They can get some pretty bizarre scattered atypia. And then you can think about there are times where there's this kind of intermediate thing between neurofibroma and malignant peripheral nerve sheath tumor that's called atypical neurofibromatous neoplasm of uncertain biologic behavior, I think, ANU, ANNUBB. I can't remember the abbreviation. I'll put the link down below. In any case, in NF1 patients with a lot of atypia, there are papers about this and about what you should look for and how many mitoses are allowed and all that stuff. It's kind of complicated. But I actually have a video about neurofibromatosis and low-grade MPNST, and it talks about it to some extent in there, and then also a video about regular, typical high-grade MPNST. So if you want to explore that, you can. But the more important thing is that scattered atypia is seen in many nerve sheath tumors, and it's totally benign and indolent by itself, okay? It does not mean anything bad to see scattered pleomorphism in an otherwise characteristic schwannoma or a neurofibroma. Even, you can see them in granular cell tumors. So that's the thing, is degenerative atypia is a common feature in nerve sheath tumors. All right. And so finding scattered atypia in a background of cells that kind of look like Schwann cells or neural cells is actually really quite helpful to support schwannoma. Finding the loose areas, the Antoni B areas, are helpful. These areas to me look sometimes almost like neurofibroma. They get a little bit of that almost shredded carrots of pink collagen floating in a loose edematous kind of white background, and more haphazard cells. So I find that stuff is pretty helpful. And there's back to the Antoni A. See, look, if you just had that, you might not, there's vague palisading there, but it's very vague, very, very vague. You could potentially get concerned about this, right? Mm-hmm. So look, that one's got a big pseudo-inclusion, a nuclear pseudo-inclusion. All right, and then look out here. Big, thick, fibrous capsule, right? So the capsule is a pretty common feature in schwannomas, because the schwannoma, kind of the idea is it grows inside a nerve usually, right? It's arising off a nerve, and it grows and pushes the perineurium outward, and then that gets kind of fibrotic. But if you'll do like an EMA or a GLUT1 or a clot and a perineurial marker, a lot of times you'll find kind of layers of perineurial cells in that dense sclerotic stuff. You don't need to do that, but anyway, it's there. And then the other thing is this, hyalinized vessels. I find that really helpful, and it's usually present sclerotic homogenized collagen in the vessel wall. Sometimes it can be very extensive. Sometimes also the vessels leak and they get blood and blood around them and hemosiderin, and they also will get bright pink fibrin in the vessel wall and around the vessel. So you'll have sclerotic collagen and fibrin kind of layered around vessels. And those ones that get really bloody and have a lot of vascular changes, I find they really confuse people, because the blood and the cystic formation really makes people think of like vascular stuff and other things, not schwannoma. So I don't have a good example of that handy to show. But in any case, those are all features you can think of. And there, that was the best. I mean, that's what the textbook shows, because everyone wants to see that, right? Because it's pretty and it's really easy to recognize, and even med students, we teach them. But when you don't have that, if you don't know those other subtle features of schwannoma, you can be in trouble. And I did say if it looks Schwannian, well, cytologically, there are a couple clues to Schwann cells. Let me see if I can find some here. But I do find if you have, the thing that I think is some of the hardest things to tell apart is fibroblastic proliferations and neural proliferations. The cells and kind of their arrangement can look very similar. There are a lot of fibroblastic things that can mimic neural things and vice versa. Like, for example, dermatofibrosarcoma protuberans, which is kind of like a fibroblastic type of derivation, we think. It can look a lot like diffuse neurofibroma. And there are many other examples like that. So if you struggle with that, I do too. And I find that that's where S100 or SOX10, a neural marker like that, can be very helpful in sorting out neural lesions from fibroblastic. So Schwann cells tend to be shaped, they look a little different at one end than at the other. Now, that not every Schwann cell will do this. Let me see if I can find a good example. I should have looked this up and marked it before. Okay, so one pattern is this. See this cell right here? Look, it's got like a flat line on one side, and then the other kind of a rounded edge, kind of like the shape of a bullet, right? A bullet, flattened bottom and rounded top. Other times, the bottom is kind of not as flat and is more rounded, and they look kind of like a sesame seed, like you put on top of a bun to have on a sandwich. And so I don't know if I've seen any real good sesame-shaped ones here, but sometimes they are like pointed on one end and rounded or blunted on the other. And Mark Edgar taught me that, one of my great soft tissue mentors who had so many great visual clues for diagnosis. The other thing that Mark taught me that I found really helpful is this. Schwann cells like to be in pairs, like partnered up end to end, where you have one Schwann cell and then here's another. There's actually like maybe 3 or 4 right here, but see how they're in a little row, and the blunt ends butt up against each other, right? Like you took two bullets and put the flat side back to back. And hopefully YouTube doesn't ban this for talking about bullets. But in any case, I'm not advocating anything. I'm just trying to make a visual reference. Okay. So there, you can see them where they touch, right? You have like one and then another one touching right against each other. So there, I admit it's very subtle, but sometimes those subtle things, seeing the little chain of nuclei, the flat end and then the rounded end, can really make me think, ooh, maybe this is neural, if it's a hard case. The other thing that they do is they sometimes have like kind of an S shape or a bent or buckled or crooked shaped nucleus. And I'm trying to find a good one of those. So that one, right? It's not perfectly straight. It's kind of curved a little bit like a boomerang maybe. And sometimes they're curved even more, like kind of if you took the top of a can of, soda or Coke and you popped it, that little tab that you pop, instead of being flat, it's bent in the middle. And I think a lot of times Schwann cell nuclei look that way. I think you see the nuclear feature actually a little bit better sometimes in neurofibromas because they're a little bit more loose and spaced out and not packed together like they are in Schwannomas. So maybe next time you see a neurofibroma, go look around and see if you can find some of these cells. Because once Mark had told me that, I started looking for it, and I was like, oh, it's totally, that really works. Those features are there more often than I realized, and I just hadn't been looking for them. So anyway, we've now dove really deep in, and I do have a full-length video about Schwannoma, although I've talked about this one long enough that it's going to probably approach the length of that video. But if you want to learn more about nerve sheath tumors, I'll put links in the description down below. And there you go. So Schwannoma, benign and beautiful, although they can be painful sometimes because they come off the nerve. All right.